Good afternoon, everyone, and thank you again for joining us for the daily briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are again joining us virtually to adhere to social distancing guidelines. We begin our briefing now with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everyone. I want to start off today with an update on the city's financial health. We now have figures on April tax collections, which to a certain degree reflects activity in March when the shutdown of business activity began. April collections were only half that of April of 2019. And this is the first clear indicator of the local impact of COVID-19 on city revenues. Specifically, April collections totaled $385 million, which is 47% lower than the previous April. Now, to be clear, some of the decline is due to the extension in the deadline for filing the city's business income receipts tax, or BIRT, from April 15th to July 15th. Excluding that factor, the April 2020 drop is about 15% below the April 2019. Still, this April decline certainly reflects the tremendous drop in economic activity throughout the city as a result of the shutdown. Our anticipation of this sort of drop is what led our administration last week to propose a belt-tightening budget for the coming fiscal year. We knew this was coming, and now we have some preliminary numbers that offer proof. And as I said last week, we stand ready to work with members of City Council as they begin consideration of this very painful but necessary budget proposal. I want to speak about a topic today that has increasingly become a dangerous side effect of the stay-at-home order, and that is the lack of residents obeying our traffic safety laws. With fewer cars on the roads, some people thoughtlessly think it's okay to speed, make illegal movements, or run red lights and stop signs. This unsafe behavior is starting to show up in our traffic crash data. In April, we recorded 3 traffic fatalities in Philadelphia for the entire month. This week, police reported 3 deaths from traffic fatalities in a matter of days. These stats are trending in the wrong direction, and this unsafe behavior has to stop. We maintain that traffic deaths are preventable and unacceptable under our Vision Zero action plan. So I'm here today to say we are not going to tolerate this illegal behavior. We need everyone to obey our traffic laws and make safety the priority when you walk, drive, or bike. If you see someone speeding or otherwise observe illegal traffic behavior, please call 911, maybe try to get the license plate and description of the car. The safety of people who walk, bike, and drive is paramount as we continue to enforce the stay-at-home order. On a more positive note, May is National Bike Month. Many of you have been taking advantage of the nicer weather to walk, run, or ride a bike for exercise. We encourage everyone that bikes to conduct a bike safety check. Residents should check their bikes, check their helmets, and show their family how to properly fit helmets. When you bike, stay 6 feet away from others, obey traffic laws, and wash your hands before and after going out. These safety tips and more can be found on the @PhillyOtis Twitter account, or you can visit visionzerophl.com to learn more. I also want to remind residents that Indigo is available for those who want to ride safely and exercise while being socially distant. Indigo is offering discounted monthly passes to anyone who signs up through the end of the month. $5 will buy a monthly pass that gets you 30 days of unlimited 1-hour rides. To learn more about this offer, visit rideindigo.com. That's rideindigo.com. Now I'll ask Dr. Farley for his daily update.
Good afternoon. The situation with the epidemic today is looking better in several ways. So here are details. We've had 350 cases of the coronavirus infection diagnosed in Philadelphia residents in the past 24 hours, bringing us to 17,047 since the beginning of the epidemic. The trend in the number of cases is clearly downward, and it may be that it's picking up speed in the way that it's going now. We're also seeing progress in our infections in congregate settings where people live together. We're seeing a decline in cases in nursing homes and in our city's jail. So today we have a total of 23 inmates that are testing positive. That includes 0 new positives since yesterday and 3 others who have recovered and been removed from isolation. This is now 4 days in a row when we've had no new cases in the city's jail. That's a very good thing. The data on the city's jail cluster is going to be updated on our website under the Testing and Data tab at the bottom of the page. We're going to be updating that daily, and so I won't be reporting that in this session every day in the future. We have a total of 13 new deaths from the coronavirus infection confirmed and reported today, bringing us to a total of 816 since the beginning of the epidemic. So the number of daily deaths is also on a downward trend, which is also a good sign. Of the total 816 deaths, 425 or 52% were nursing home residents. Our hospitals also, things are looking better there. As of this morning, we had 911 people with the coronavirus infection in hospitals in Philadelphia and 1,677 in hospitals across the Philadelphia region. And that's a decrease from yesterday. And overall, it's a decrease of about 10% since the peak of the epidemic or the surge in the hospitals. And that's very much a good sign. Good news also on testing. We continue to add testing sites across the city. There are now more than 40 in the city of Philadelphia and more than 60 that we know of in the Philadelphia region. I won't list those individual sites, but just to give you a sense of the different places that are offering testing. It includes hospitals, including the University of Pennsylvania, Jefferson Health System, Temple's Health System, Mainline Health, and CHOP, Children's Hospital of Philadelphia. It includes a large number of sites at community health centers. It includes sites run by pharmacies, particularly Rite Aid, which has one site now, but will soon be adding other sites. And it includes urgent care centers. Now, for most of these sites, they're asking that people call ahead to make an appointment. The phone numbers for all these sites are on our website. If you go to the website under who should be tested, all the sites are listed there. It's a little hard to find now, but we're going to update that website. And to make it easier, we're going to post a map on the website that has all the sites identified. And if you click on the site, you can get more information about what that site's criteria are for testing and what phone number you can call to make an appointment. Now, there's some sites that have open appointments that have asked me to just communicate them to you so that everybody knows they can go there for testing. The Public Health Management Corporation has sites at these three addresses: 1900 North 9th Street, and the Mary Howard Health Center at 125 South 9th Street, the Rising Sun Health Center at 5675 North Front Street, that's 5675 North Front Street, and Congresso Health Center at 412 West Lehigh Avenue. For any of those sites, if you want an appointment, you can call 1-855-877-9229. Now, all the data says that in general, we're moving in the right direction, that our actions that we're doing right now are absolutely slowing the spread of the virus. That's a very good thing. At the same time, the fact we have 350 cases in a day means that there are plenty of people out there with this infection, so we're not ready to reopen yet. But if we want to get to the point where we can safely reopen, we need to just keep doing what we're doing. And what that's really is about is stay home, or if you're out of home, wearing one of these things. I don't like wearing a mask any more than anybody else, but this really is the key to us reopening Philadelphia in a safe way so we can get our economy moving and not have the virus get going at the same time. So if you're not used to wearing one of these, get used to it now. It's going to make a big difference in the future. If you want more information about the epidemic, just go to our website, www.phila.gov/COVID, or for medical questions, 1-800-722-7112. Thanks.
All right, thank you, Dr. Farley. Now we go to Armando for the Spanish language translation of the mayor's and Dr. Farley's comments.
Mensaje del alcalde Jim Kenney para el día jueves 7 de mayo del 2020. Buenas tardes a todos. Quiero comenzar hoy con una actualización sobre la salud de las finanzas de la ciudad. Ya tenemos cifras sobre la recaudación de impuestos de abril, que en cierta medida refleja la actividad de marzo, cuando comenzó el cierre de la actividad comercial. La recaudación de impuestos del mes de abril fue solo la mitad de la del año 2019 y este es un claro indicador del impacto del COVID-19 en los ingresos de la ciudad. Específicamente, la recolección de impuestos del mes de abril llegó a $385 millones, un 47% más bajo que en abril del año anterior. Ahora, para ser claros, parte de la disminución se debe a la extensión en el plazo para presentar el impuesto sobre los ingresos comerciales de la ciudad, o BIRT, del 15 de abril al 15 de julio. Excluyendo este factor, la caída de abril del año 2020 es aproximadamente un 15% inferior a la de abril del año 2019. Aún así, esta disminución refleja ciertamente el tremendo descenso en la actividad económica en toda la ciudad como resultado del cierre temporal de los comercios por el COVID-19. Esta disminución era previsible y fue lo que la semana pasada nos llevó a proponer un presupuesto de ajuste para el próximo año fiscal. Sabíamos que esto iba a suceder y ahora tenemos algunas cifras preliminares que nos confirman esto. La semana pasada señalé que estamos listos para trabajar con los miembros del Consejo Municipal mientras comienzan a considerar esta dolorosa propuesta de presupuesto. Y reitero mi mensaje, estamos listos. Hoy quiero hablarles también sobre un tema que se ha convertido en un efecto secundario peligroso de la orden de permanencia en casa, y esto es la desobediencia de algunos conductores a nuestras leyes de seguridad vial. Con menos automóviles en las carreteras, algunas personas piensan que está bien acelerar, hacer maniobras ilegales o pasarse las luces rojas y las señales de alto. Este comportamiento inseguro está comenzando a aparecer en nuestras estadísticas de choques en la ciudad. En Filadelfia, en el mes de abril, registramos 3 muertes por accidentes de tránsito durante todo el mes. Esta semana, la policía reportó 3 muertes por accidentes de tránsito en cuestión de días. Estas estadísticas muestran que vamos en la dirección incorrecta y esta conducta tiene que parar. Las muertes por accidentes de tránsito son prevenibles e inaceptables según nuestro plan de acción Visión Cero. Estoy aquí para decirles que no vamos a tolerar este comportamiento ilegal. Necesitamos que todos obedezcan nuestras leyes de tránsito y que la seguridad sea prioridad al caminar, conducir o montar en bicicleta. Si ve a alguien acelerando o observa un comportamiento de tráfico ilegal, llame al 911. La seguridad de las personas que caminan, andan en bicicleta y conducen es primordial a medida que continuamos aplicando la orden de permanencia en casa. En una nota más positiva, mayo también es el mes nacional de la bicicleta. Muchos de ustedes han aprovechado este clima agradable para caminar, correr o andar en bicicleta para ejercitarse. Les alentamos a todos los ciclistas a que realicen un control de seguridad de sus bicicletas y a verificar el ajuste de su casco. Asimismo, les recomendamos enseñarles a otros miembros de su familia cómo ajustarlo adecuadamente. Cuando ande en bicicleta, manténgase a 6 pies de distancia de los demás, obedezca las leyes de tránsito y lávese las manos antes y después de salir. Puede usted encontrar consejos de seguridad como este y más en la cuenta de Twitter de @PhillyOtis o puede visitar visionzerophl.com para obtener mayor información. También quiero recordarles a los residentes que Indigo está disponible para aquellos que desean viajar de manera segura y hacer ejercicio mientras respetan la distancia social. Indigo ofrece pases mensuales con descuento a cualquier persona que se registre hasta el final de este mes. Con $5 puede adquirir un pase mensual que le brinda 30 días de viajes ilimitados de 1 hora. Para obtener mayor información sobre esta oferta, visite rideindigo.com. Y esta es la actualización en materia de salud al día 7 de mayo del 2020. Desde ayer se han confirmado 350 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 17,047 casos en la ciudad. Se ve una clara tendencia a la disminución de los casos. Hoy no reportamos casos positivos de COVID-19 entre los internos y actualmente hay 23 casos registrados con 3 internos adicionales que se han recuperado satisfactoriamente. Tenemos 4 días seguidos sin reportar casos en los centros correccionales. De ahora en adelante podrán conseguir esta información en el sitio web porque no lo reportaremos más por esta vía. Las cifras pueden verificarse en la sección Testing y Data. Hoy, tristemente, reportamos 13 muertes por COVID-19 en la ciudad. Hay un total de 816 personas que han muerto por el COVID-19. 425 o el 52% de estas muertes han sido en hogares de ancianos. Les recordamos que este virus no discrimina por raza o por género. Hay 911 personas que han sido hospitalizadas en Filadelfia y 1,677 personas en la región sureste de Pensilvania. Estas cifras demuestran un claro descenso. Estamos en un 10% por debajo del número más alto de pacientes hospitalizados. Las pruebas siguen disponibles con cita previa. Para más información, como direcciones o números de teléfono de los centros de prueba, por favor revisar el sitio web fila.gov/COVID-19 bajo la pestaña FAQ. Hay 40 centros de prueba en la ciudad de Filadelfia y 60 en toda la región. Los hospitales Penn, Jefferson, Temple y Mainline Health, los centros de salud comunitarios, farmacias como Rite Aid, centros de atención de urgencias o Urgent Care Centers. Y también queremos recalcar la ubicación de 2 centros de prueba, el PHMC Health Connection, que queda en el 1900 norte de la calle 9, el Mary Howard Health Center en el 125 sur de la calle 9, el Rising Sun Healthcare Center en el 5675 norte de la calle Front, Congreso en el 412 Wesley High, y recordándoles que para hacer citas y para obtener mayor información pueden llamar al 1-822-877-9229. Los datos nos muestran que vamos en la dirección correcta. Nuestras acciones y conductas están deteniendo la propagación del virus. Tenemos que mantener estas medidas y, por lo tanto, les pedimos permanecer en casa y si es que tienen que salir para hacer alguna actividad esencial, usen la máscara porque esto es absolutamente necesario. Hay que recordar que mi máscara te protege a ti, tu máscara me protege a mí. Juntos podemos superar este gran reto. Gracias.
Very good. Thank you, Armando. We are now going to move to the Q&A portion for members of the press. I want to note that Finance Director Rob Dubow and Budget Director Marissa Waxman have joined us today in case there are press questions regarding the mayor's earlier announcement on April tax collections. Please remember that we have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature, and we ask that you use your video to ask your question when you are called on. We will unmute the reporters one by one to ask their questions. And starting us off today is Layla Jones of Billy Penn. Layla, you're up.
Hi, thank you. My question is for Dr. Farley. Dr. Farley, what's your opinion on antibody testing in general right now? Since they're so widely available, is the city exploring that as an option? And how would you feel about a private medical company running these tests?
So there's a couple of problems with antibody testing. First, there are some antibody tests out there that are just not high quality, and so the results are not reliable. Then even for those tests that are reliable, we don't know yet how to interpret the results. Somebody has a positive test, we cannot say with confidence that they are immune to this. People want to know that, but there's still not enough known research out there about what a high antibody level actually means. It is possible, for example, that if someone were infected with a different type of coronavirus, because there are different coronaviruses that circulate every year, that might cause an elevated antibody test, and somebody might believe that they're immune when they're in fact not immune. So I think antibody tests will have a role over time with this, but we need to understand how to interpret a positive test, even with the quality tests first. So we're not recommending people to use antibody tests right now. I know they are available, people can get them done, but the fact that we don't know how to counsel people about the results is a real problem until we have more research done.
Okay, and would an FDA-approved test change your outlook at all?
Well, an FDA-approved test is probably a higher quality test, but we still then have the problem of how to interpret the results. We can't guarantee that that means you're immune to the virus. And I'm concerned that people will get a test, they believe that they're immune, and then they'll not wear a mask, and they may do things that put themselves at high risk, and then may get an infection because they're not immune and could get seriously ill. At some point in the future, we may know that a positive result means that you're immune, and then that would be very useful information. But right now, when we don't know that, I wouldn't be recommending people test themselves for that reason.
Okay, thank you.
Thank you, Layla. Next up is Claudia Vargas of NBC 10.
Hello. I wanted to know, with the $85 million that was allocated for the COVID response, do you guys expect to spend all of that this fiscal year? And if there's money that's left over, can that be rolled over into fiscal year 21?
Maria or Rob, do you want to tackle that?
Sure. We do expect to spend all of that money this year, which then makes the second question moot.
Okay, so far, I guess I looked at the most recent expenditures, and so far only 20.3 million has been spent. So where do you expect that the rest of the money will come in from, given that things are starting to wind down?
Yeah, Marissa can walk you through that.
Okay.
Sure. So we're releasing a biweekly report that reflects that 20.38 millions encumbered or spent to date. But there's a couple of things not yet included in there. First is the labor costs that we've incurred. Certainly in the beginning when we were offering a pay incentive so that we could continue to deliver essential services, we're still gathering that and refining that information now. And we know that that is going to be a very significant expense for us. Additionally, there's a number of costs that basically we know are in the pipeline, but haven't actually been billed yet. So things related to the Leah Chorus Center that haven't been billed yet. So even as the activity is ramping down, the bills are still coming in. And then we have other things that are we anticipate as we attempt to move towards reopening the economy, as well as just other costs related to quarantine services and other locations. So we anticipate as we update that on a biweekly basis to include both the labor costs and continuing costs or bills as we get them, that will, as Rob said, reach up to that level that we anticipate spending this fiscal year.
Okay. But should there be any money left over, can that be rolled over, or does it all have to be used this year?
Marissa, your camera is off. I don't know if you're able to put that on.
It cannot be rolled over if it's not spent, but we think it will all be spent.
Okay. Great. Thank you. That's all.
Okay, great. Thank you, Claudia. Now we go to Natasha Brown of CBS 3.
Hi, this question is just for the mayor. Please, if you could just talk to me a little bit about, we understand there are 2 planned protests now, possibly for tomorrow, people that are obviously lobbying to have Philadelphia reopen sooner than, or some kind of date at least expected as to when Philadelphia can reopen in light of all this. One at noon where people are going to be riding in cars, we understand, the other at 5 p.m. If you can just talk to me a little bit about that and just how you guys plan on at least dealing with that or controlling that.
Well, the noon one we knew about and expected a potential counter protest. Do you know who the group is for the 5 o'clock?
I'm not sure. Somebody was on my Twitter page and we're talking about the fact that there's a whole separate group at 5 p.m. that's planning something. So I don't know if that's a counter protest or if that's going to be people lobbying to open Philly as well. I'm not sure.
Brian, do you know?
No, I don't know. We'll certainly see if we can find out and get back to you. But the 5 o'clock is new information to me.
I mean, okay. whatever protests we have, we'll treat with First Amendment respect, as long as people are expressing their views in a reasonable way and not damaging property or hurting anyone else, which I don't expect that to happen. So we'll see how it rolls out. Our civil affairs folks and our police department are extremely capable of handling these. We've been handling protests for quite some time, and we'll see what happens.
Okay, thank you so much. And then also for Dr. Farley, we're just hearing from Governor Cuomo in New York recently, as early as today or yesterday, just about how what they're finding now are people that are still showing up in hospitals, having symptoms of the virus and having the virus, even though they have been staying at home. They've not been out and about. They say there's just a growing number of people that are apparently still abiding by the rules, staying home, but are still showing up in hospitals with this virus. And they're wondering how that's happening. Any thoughts on that? I mean, hopefully that doesn't happen here, but your thoughts on that?
I can't say what data they're looking at in New York. I don't think that there's any new way that this virus is being spread that's going to surprise us. I'm going to guess that those people might have had household members who had the infection, or in fact that they did go out of the house more than they recognized or remembered and came in contact with people elsewhere. It's still, this virus is spread mainly through direct personal contact and through secretions. And so if you do stay home and if you wear a mask, you're going to greatly reduce your risk of getting the infection.
Okay, thank you very much. That's all I have.
Great. Thank you, Natasha. Next up, we go to Hannah Chin of WHYY.
Great. Thank you so much. I have a question for Commissioner Farley, which is that we were wondering whether or not you've talked about apps for contact tracing any further. I know that in a recent press briefing, you mentioned that you would be looking into apps in terms of contact tracing. What would be the possible value of technology? Do you have any updates on that?
There are no real updates on that. We are still looking into them. We understand that Google and Apple have developed the ability for cell phones to communicate so that apps can be built. So where someone has a positive result and they have turned on the app, then we can identify people whose cell phones were in proximity to that person who've also turned on the app. So usefulness of this app will depend on people actually opting into it. And that's a practical issue which we're really going to have to address. I don't know if any of those apps are actually written yet, but we certainly will look into them, and they may play a role in the overall contact tracing approach.
Got it. So are you encouraging Philadelphians to use those apps now?
I don't know if any of them exist right now. When they do, and if we're out there, when I've got our system in place, then we'll communicate that. And if so, we may say to people, we would recommend or ask that you turn on this information so that we can do the contact tracing effectively if a case were to occur.
All right, thank you.
Are you all set, Hannah?
Yes, thank you.
Okay, very good. Thank you. We go now to Laura McChrystal of the Inquirer.
Hi, I have a couple questions first about the tax revenue. Are there any specific examples you can provide of certain taxes and how much they decreased for April collections?
Sure, we can walk you through some of them. So, for example, the transfer tax was way down, but in part that's because it was really high last year. So it was down from 41.7 last year to 14.4 this year, but a typical month is usually more in the 20s. The parking tax, as you would kind of think, was way down from about 8.8 million to 4.4 million. And the hotel tax was down significantly from about 6.5 million to about 1.9 million.
Okay. And as far as your projections for tax revenue in fiscal year 21, I know you've said that taxes, the budget shows that you expect decreases in tax revenue. But I'm wondering, was that based on an assumption, like the numbers that you do have, are they based on an assumption of, normal activity resuming at some point during that fiscal year?
So, Mercy, do you want to talk through that one?
Sure. So what we did was we worked with the city's economists who helped us develop recommendations. And what they're generally based on is the idea that we will start to reopen this summer, but it's not sort of a binary on-off. And so it anticipates that we'll continue to see sort of decreases through the coming year and possibly for some types into the following year. So we make some assumptions that parts of the economy will start to open back up, but that really things will be suppressed for a while.
Okay, thank you. And lastly, I have a question for Dr. Farley. You mentioned that hospitalizations are about 10% lower than at the peak. Could you tell me when that peak was and for how long now hospitalizations have been declining?
Well, the hospitalizations hit a peak. I'll probably get the exact time here. Let's see if I can pull it up real quick. But they've been sort of hovering around that peak for about 10 days to 2 weeks. It looks like the highest point was either April 24th or April 28th. And either one of those, we're down about 10%.
Okay, thank you.
Great, thank you, Laura. And next up is Jack Tomzik of Metro.
Hi, this question is also about the tax collection numbers. How do those numbers compare to what you were expecting for this month?
So obviously they are nowhere near what we had expected when we first made the projections for FY20. We're seeing some variations. We did begin, within the past month or so, begin to recalibrate our expectations for how FY20 would turn out. And so the losses that we're seeing, for example, in the amusement tax, are what we expected at this point, basically given the shutdown. There are others that, we're continuing to watch and see what exactly they're doing. It's still a bit early because while these are April collections, for some of these, they reflect activity that happened in March or earlier. And so they're still pre-COVID.
And then my second question, does anyone from the city have any more info on the potential layoffs, and have any city employees been let go yet?
Right. So there have been some verbal notifications to employees, exempt employees. Those notifications are ongoing, but I don't have final numbers on on the number of layoffs as we work through both exempt and represented employees.
And for those verbal notifications, is that something where it's you're setting a date, or are they immediately laid off once they receive?
All of our exempt employees will be separated on June 1st. In most instances, those exempt employees are taking excused leave from now until June 1st.
Okay, thank you.
Good, Jack?
Yes.
All right, very good. Let's go now to Denise Clay of the Philadelphia Sunday Sun.
Okay, I had two questions. The first concerns the homeless funds in terms of for the city and the hotels that the homeless were occupying. Is the city's COVID protocol for the homeless based on the way the COVID funds are allowed to be used as it relates to allowing the homeless into the hotels?
Yes.
Okay. All right. Also, I had a question regarding, and this is for Dr. Farley. You're saying that things are starting to, go down in terms of cases and stuff, and that's great. But there's also been more than a few times where folks have said that people are not universally following the guidelines of wearing a mask when you go out, staying home, and different things. As we open up the city more, what, I guess, are you concerned that the minute that, you say, okay, well, Philadelphia's open for business, everybody takes their masks off, goes back out? Because if you're already seeing some of that, what's to say that's not going to happen?
So I do think most people right now are following our recommendations. We have that from survey data. The people you see outside may be the ones that are not following our recommendations. But the data says that what we're doing so far is good enough, so that the fact that most people is working to reduce the rate of infection. But we are absolutely concerned that if we open up some sectors of the economy, people may think it's licensed for them to go back to the way things were before. So that's why I give the message every single day. Even when we do this, people are going to have to be wearing a mask outside because if we go back to the way we were operating before the epidemic, there's no question the virus will pick up again.
Okay. And last for you, Dr. Farley, there's a bill currently going through the legislature in Harrisburg that would allow barbershops and hairdressers to open before official reopening because these are people who aren't necessarily, being able to take advantage of unemployment or PPP loans or different things. Have you heard about this bill, and what do you think about it?
I have not heard about the bill, but I would oppose any bill that singles out a specific type of workplace or a specific sector of the economy. We know a lot of people are suffering from this, and we're totally sympathetic to that. We want to open as soon as possible. We want to open safely. We think that barbershops and other salons can open up in a safe way, but that needs to be part of a larger context. We're not ready there yet.
Okay, thank you.
Thank you, Denise. Now let's go to Hannah Seawald of the Temple Update. Go ahead, Hannah. Let me try that again. All right.
Hi, yes. So my question is, how is the city coordinating with the various universities in the city about a plan for when and how some or all students can return to their campuses in the fall?
And Dr. Farley, do you want to take that or you want me to?
Why don't you take that?
Sure. So at this point, I think we're still trying to figure out exactly what our reopening plan looks like. So we certainly have had conversations with the, with the universities, but we're not at the point yet where we're talking about reopening in the fall. I think we are still trying to figure out exactly what the virus does and how we respond to it over time. But certainly we will have guidance for universities as we go forward.
Okay, great. Thank you.
And are you all set?
Yes, all set.
Very good. Next, we go to Julie Hancher.
Hi, I have two questions. My first is, have you had any statistics on recycling rates since the city switched to a biweekly schedule?
I do not have those with me, but I can certainly circle back with our sanitation team and get back to you.
That'd be great. Thank you. And my other question is, I saw that one of the impacts from the budget cuts is that the zero waste and litter cabinet will be dissolved. I was curious how this will impact the city's zero waste goals and that strategy.
So I don't think it impacts the goals at this point. You know, the zero waste and litter cabinet's done excellent work. But I don't think that work needs to necessarily happen in a separate cabinet. I think that work will be integrated into the Office of Sustainability, and I'm confident that it'll be able to be continued going forward.
Will there be a specific person handling that role under the Office of Sustainability? Because I know there was a director that seems like that position would also be eliminated. So I was curious how the personnel would transfer over to a different department.
So we're not talking about personnel at this point. I think we'll be able to announce what that organization chart looks like in the future. But we do expect personnel to be able to manage that work directly.
Okay, thank you.
Yep.
Thank you, Julie. Next, Pat Loeb of KYW.
Dr. Farley, I wanted to get your comment on the White House's decision not to go with the CDC guidance on reopening. And also, is the guidance that they offered something that you would recommend the city adhere to?
Well, we just saw the story. We have gotten the CDC guidance and we're looking at it now. I can say that I have a lot of confidence in CDC's judgment. So I think it's going to be very useful to us. I'm very disappointed that the White House is not listening to the CDC. They should have been listening to the CDC all along. We will certainly listen to the CDC here.
Thank you.
Anything else, Pat?
Nope, that's it. Thanks.
Okay, this is the last call for questions. If you have any further questions, please raise your hand. And now for the second round, we'll go to Brian McCrone of NBC 10.
Hey there. Thanks, everyone. Question, I guess, for Mayor Kenny. Is there anything in the works for a 5th annual Philly Free Streets in August? And on a broader level, do you have any plans at all for even sooner than then, opening up more streets in the spring and summer?
I know there's conversations about the event, weighing the pros and cons of, getting people out and allowing them to socially distance each other, but get some exercise in and the like. But there's also the downside of people congregating and being too close proximity. So decisions have not been made yet, but we'll continue talking it out and see what can be done or what can't be done. And Brian, you could talk about street closures if you like.
Sure. At this point, we've gotten a number of requests to close streets. At this point, I don't think we'll be closing additional streets prior to reopening.
Okay. And then the follow up would be to that is, I guess maybe Mayor, you explain it a little bit, but so just a little bit more succinct. What are the obstacles to closing up streets of vehicular traffic on a broader scope? And then also just real quick, just if you could, what streets would you envision would be great to close on a broader scope?
I have not envisioned personally closing any streets. Brian has done the day-to-day management of issues like that. He has specific ideas about why the good and the bad of doing that, and maybe he can explain that to you.
Yeah. So I was going to say before the mayor responded, I was like, wait, I don't think we said that we had envisioned closing off a whole bunch of streets.
No, this is just hypothetically, I suppose.
Okay,
what
would
you love to close?
We're not going to talk in hypotheticals. So look, we are in the midst of responding to a COVID crisis. We're trying to manage a city and make it operate. And at the same time, we're managing a fiscal crisis. And so all of my operating departments are stressed to the limits at this point. And to close streets, while I certainly understand the advocate's position and why they want us to do it, I'm not sure, while I would give people some additional places to recreate, I think there are lots of places to recreate right now. and could send mixed messages about why we're saying, okay, yes, you can go outside, but don't gather in one spot. And so I'm just, we've looked at this off and on for a long time. I appreciate people's perspectives, but at this point, we just don't see what problem we're trying to solve by closing additional streets. I need those resources to spend elsewhere at this point.
Great. Thank you, Brian. Thanks.
Yep.
Then next up, Claudia Lauer of the Associated Press.
Hey, how are you? I was curious. I know we've talked about this before. This is for Dr. Farley. Are there any, I'm trying to figure out how to word this. So is there any guarantee that the coroner's office is, if people don't die in a hospital and they are corona positive or COVID positive, or if they don't die in a medical facility and they are COVID positive, is there any way to guarantee that they are being counted in the COVID count? Like, are they testing people at the morgue or through the coroner's or medical examiner's office?
So, this gets at a larger issue. Each year with the influenza epidemic that we have every year, we count a certain number of people who we know died of influenza. And then later, when you look at the overall death statistics, you see a rise in deaths, which is far greater than the number of cases that you actually count. And that's because they have people with, say, maybe bad chronic heart disease or chronic lung disease who die and are never tested. And so their cause of death is listed on their death certificate as heart disease or lung disease. And you don't know that influenza, in fact, is what tipped them over. We expect the same is probably true to one degree or another with the coronavirus epidemic, that we are counting certain cases that were tested that we know where those deaths were caused by coronavirus. But later, when we look back at our death statistics, I expect that we will find more people who have died, who had some sort of chronic medical condition, and that were never tested. And so they're never given that diagnosis. And we won't be able to count them ever. We won't be able to identify them specifically, but we will be able to come up with an estimate of the total number. So we do think that because of that, we're probably undercounting deaths. I can't say how big it is. We won't be able to know that until we really get all our death statistics in.
Okay. I had heard that there have been an increase in deaths in Kensington, which I think a lot of people are immediately jump to saying that they're overdose deaths, but I wasn't sure if, overdose deaths or people who are perceived to have died of overdoses are being tested for COVID as well.
Probably some are and some are not. We certainly have plenty of overdose tests in the city at all times. And so, I can't say that, but I can say probably when we ultimately look back on this time period, we will count more deaths related to this epidemic than we're able to count right now.
Got it. Okay. Thank you.
Thank you, Claudia. And next we go to Laura McChrystal of the Inquirer.
Yeah.
Sorry, Laura, go ahead.
Oh, that's okay. I couldn't get unmuted there. One more question for Dr. Farley. You had mentioned that nursing home cases have also been decreasing. Can you expand on that a little more? Do you have any numbers, or can you characterize how encouraging it is, or by how much they're decreasing?
I can't give you any exact numbers now. I can say that we are working on assembling the information we have on all the people who have for nursing homes who have the infection. Our early looks at the graph of that is it's in parallel with the graph we're seeing in the community, and so that's a sign that those number of deaths appear to be declining over time. We hope in the future to be able to have a more complete picture, and when we do, then we'll be able to present something so that you can see what we're looking at. We're not going to talk about specific nursing homes, but we will talk about the nursing homes as a whole and across the city.
Okay, and you say that it's declining in parallel with the graph in the rest of the community. Has it sort of been parallel to the rest of the community all along, or is it just the decline that's now parallel?
Well, it rose more or less in parallel, and it's probably falling more or less in parallel. When we have the graph, when we actually lay it against each other, we'll get a sense for whether the peaks were different times or other ways in which they're similar. But I can say it just looks right now like it's declining, and that's a good thing.
Okay, thanks.
Thank you, Laura. And there are no further questions. We do want to note that we will not be holding a 1 p.m. briefing.
I heard you. You said absolutely, you're right.
We will not be holding a 1 p.m. briefing tomorrow because the mayor and managing director will be attending the funeral for Philadelphia Police Corporal James O'Connor. We will still put out a release tomorrow at 1 p.m., a press release like we do on the weekends. But again, no briefing tomorrow at 1. We will resume these briefings next Monday, May 11th at 1 p.m. Until then, thank you. That concludes today's daily briefing.